All right. Hello, everyone, and welcome again to another YMCA Education Series talk. Today we have Denise Schwartz, who will be talking to us about neck pain, healing neck pain naturally. Yay! We will be recording today's session, so it's on our podcast library on our website. You can able to find that and reference it later in case you miss anything. It will be there about later today. This program lasts about an hour. Save your questions to the end if you can. Otherwise, put them in the chat box, and Denise or I will get them to Denise during the talk. She doesn't. She won't be watching it too closely, but we will get them to her. Awesome. All right. Today's talk. Do you occasionally wake up with a kink in your neck? Do you have trouble turning your head while you're driving? Do you have headaches that start at the base of your head? All these questions and more will be addressed today by the Manual Touches Denise Schwartz. Welcome, Denise.
Thank you, Pam. I'm excited to be back. All right, let me get this set up here. Okay, Pam, I didn't have it at the beginning. All right, my mouse still available there? You can still see the arrow?
Yes, you are so good.
Okay, cool. All right. Well, welcome everyone. Thank you for coming, and thank you, Pam, for having me again. I really enjoy doing these webinars for the YMCA community. Today, we're going to talk about healing neck pain naturally. As Pam said, I am a physical therapist and owner of the Manual Touch Physical Therapy in Wheeling. I am right at Milwaukee and Dundee Road, so just outside of Northbrook. I've been a PT for a very long time. I started my career at Lutheran General Hospital a long time ago. I left the hospital to work for a non-traditional PT company called Center IMT after 14 years, learning a very specific hands-on approach to healing chronic illness and pain and dysfunction. And what I found when I was working at the hospital is there were certain population that I couldn't really help with my traditional techniques. And then when I started learning this non-traditional approach, I could help everybody. So I went and worked for the company, became certified, and then we parted ways in 2010, and I started the Manual Touch Physical Therapy. What I found was that when I left the hospital to work for this non-traditional approach, that I stopped doing the traditional stuff. But, there was a lot of good stuff there. So now I do a whole body approach of traditional and non-traditional therapy to get people back doing the things that they love to do. And not only am I certified in this non-traditional hands-on therapy, I had a certification in a very functional whole body approach to exercise, certified running coach, although I usually just use this as so I have a basic understanding. I don't do run coaching, but I do run analysis for people who, for runners and triathletes. That's my son. And then I have a new tool that I've added in called the OOV and a Balance It, and we'll talk about that later as well. So are there things that you can't do because you have pain? Maybe you want to go kayaking like I did in Alaska a couple of years ago, or you want to get back to playing golf and your neck pain or any other kind of pain is limiting you. Traveling is difficult, or maybe you just want to hang out with friends, and even that is challenging to just sit for a long period of time because your neck hurts too much. Or maybe you have a huge goal like these three women that I met. I was down in Tampa. Well, this is almost already 10 years ago, I think. I was doing a half marathon, and these three very happy ladies all had these ribbons around their neck. And this was the day before the half marathon. And so they had just completed walking the 5K. And I think they completed walking the 10K that day as well. And then they were planning to walk the half marathon the next day. So they were doing the Triple Crown. They were getting themselves ready to do an amazing goal. They wanted to walk across America. And a couple years after I met them, they did complete that. They did it in 2 sections. They went from Florida to Texas in, I don't remember what it was, 4 or 5 months. And then they came back half a year later and completed the rest of it. These ladies aged from 70 to 80, and they didn't let age stop them, and they moved on. So whether you have a small goal, like just hanging out with friends without pain, or you have a huge goal like this, it's really important to take care of those issues before it gets out of control. Okay, so we're going to talk about neck pain today. We're going to talk about the 4 common causes of neck pain. There's certainly other causes. These are the ones that I see in my clinic. And even if it's something else, usually these pieces and components and treatments all approach that as well. We'll get into anatomy and what can we do about it. So the common complaints I hear when people have a neck issue, they may be coming in strictly for neck pain, but they may have arm pain or head pain, but it's really coming from their neck. They may have numbness or tingling down their arm, all the way down to their hand, to a specific finger. They may tell me that they can't move their neck as well as they used to, and it may only be one side that they can't move, or it might be both sides. Headaches, people with vertigo, it may be coming from your neck. Arm and hand weakness, and very dramatically, if you have more of a whole body weakness, like your legs and your arms, that's a very serious condition. That means the spinal cord is being affected. You got to get to a surgeon ASAP. But typically people, if they have like one hand weakness, it's coming from your neck, there's things we can do for it. People tell me that the pain interferes with their sleeping, driving, looking over your shoulder. Walking may aggravate their neck. Being on the computer, of course, getting dressed, washed, doing their hair, writing may be a problem. So any number of things can be difficult. Cutting food, preparing food, doing little activities that they couldn't do before, or that they used to do, but now that they can't anymore. So the most common causes that I see in my clinic are arthritis or stenosis, a herniated disc, or it's strictly a musculoskeletal. And I divided that up into more of soft tissue, postural weakness, or a strain in one of the neck muscles, or it's actually a bony issue. Something's going on with the vertebrae alignment, postural alignment in the skeleton. This is an ebook that I offer on my website at themanualtouch.com. Or if you'd like, please put your first and last name and your email in the chat box, and I'll be happy to send you a copy of this, as well as a copy of this PowerPoint. So don't forget, put your first and last name and your email in the chat box. All right, so let's talk about anatomy first. So we have an understanding of why we might have neck pain and what might be causing it. So here's a picture, obviously, of your spine. Here is your skull up here at the top, and just below that is your cervical spine, which is your neck. That's 7 vertebrae. Then you have your mid spine, called your thoracic spine, and that's made up of 12 vertebrae. And there's a rib that attaches to every single one of those thoracic vertebrae. Then below that is your lumbar spine, and there's 5 vertebrae. And below that is a fused segment called your sacrum. And then below that is your coccyx or tailbone. And this is your pelvis, okay? This is all connected, which is very important. I want you to remember that, because even though you come in for neck pain, quite often the reason you got this issue is because of something down below. Obviously, this is looking from the front. And I wanted you to see the front of your neck here. And I wanted you to see how close, here's your rib cage. This is your first rib. And when I tell people this, they're very shocked. They know that they have a rib cage down here, but they don't really realize that it comes all the way up to your neck. It attaches to the first thoracic vertebra, which is just below the 7th cervical. So it affects, that first rib can be a problem. And the upper part of the thoracic spine can really influence what's going on in your neck. The other thing I want you to notice is how close your jawbone and your ear is to the top of your neck. And actually, I'll have to add that to my list of complaints. Some people will have ear pain or jaw pain, and it's all very connected. And so we have to look at all those little pieces. All right, so when we look through the front here, you can see that this is your vertebrae, and in between each vertebrae is a disc. Okay, and then if we look from the side, you can see that vertebrae. Here's the disc, and then in between the discs, a nerve comes off of the spinal cord. And here you can see the spinal cord, it connected to your brain. It goes through a hole through the vertebrae back here. Okay, so it comes down. And in between each segment is a nerve. This area where the nerve comes out is called your foramen. And those of you, let's say you've already been to a doctor, let's say you've had an MRI and you see the words foraminal stenosis, that's where you get an impingement of the nerve coming off between the vertebrae. Spinal stenosis is a narrowing of the canal where the spinal cord goes down, and that's an arthritic condition where you get a narrowing of this canal. The herniated disc is actually in the disc itself it's like a jelly-filled donut. The inside of the vertebrae, the jelly part is called the nucleus, and that herniates or bulges out and presses on a nerve coming out here. And then you wind up having, let me see here. I don't have a picture of that, but the nerves that come off between each vertebrae go all the way down your arm. Okay, so that's why you'll get symptoms down here, but it's coming from up here. So it's very important for us to discern, when you're having, let's say, shoulder pain, is it actually coming from your shoulder or is it coming from your neck? If you're having elbow or hand pain or wrist pain, we have to kind of decide, differentiate, diagnose between, is it coming from your hand or wrist, such as a carpal tunnel issue? Are you having an impingement at your elbow, and so you have some forearm issue? Or is it really coming from your neck? So there's some tests that we'll do and poke around a little bit to figure out those different pieces. Here is another side view of your neck. And what they did is they cut off half of the vertebrae. And so you can see where your spinal cord is coming down from your brain, down through every vertebrae, and then it goes all the way down, right? So sometimes you'll get these vertebrae or the disc here. Most of the time it doesn't press on the spinal cord. That's a pretty dangerous condition. That's when people might have symptoms actually down all the way into their legs, okay? But most of the time it's impinging on the nerve that's coming off here, okay? This is another picture of the back of your spine, and it's just below your head. What I don't include here are pictures of all the muscles and soft tissue around the neck that can play a role. Some of the muscles that I'm going to point out more specifically, there are some little muscles right here that attach your skull to the first vertebrae. We call those the suboccipital muscles. And they're very, very, very important for balance and holding your head on your body, and it plays a big role in vision. So these muscles will actually help stabilize you as you move your eyes, as you turn your head. Very, very important. Sometimes a nerve going up into your head here will get impinged up in this place. So we have to work on some of those tissues. So those are very important muscles. So your eyes play a big role as well. Okay, so that's a brief anatomy instruction. Oh, I want to show one more thing here. There are muscles here in the front of your neck, and they attach at the vertebrae here, and they may come down here onto the rib, onto the clavicle, in here, little one. So a lot of people hear the word whiplash. Whiplash happens when, let's say, you're rear-ended and your head goes forward fast and whips back really quickly. And actually, it's a muscle strain of a front muscle here, deep inside the neck. Okay. The other thing that can happen with a whiplash is you can get a concussion, even if you don't hit your head, because it's such a fast movement that literally your brain moves in the head as well. So that's something we want to make sure is okay. Okay, so we're going to talk about arthritis, stenosis, and impingement. And if you remember, arthritis is a degeneration of the bone. So what happens is you get a wearing away of the bone here, or you actually get a buildup of the bone as it's trying to, as it's degenerating, and the discs become flatter over time. And then you get an impingement or a bone spur on the bone, and that's why you get impingement of the nerve. The stenosis, it literally means a narrowing. So the canal around the spinal cord here narrows a little bit, and typically it presses on the nerve coming out between each vertebrae. Or you may have this foraminal stenosis where it's a narrowing of that canal. When somebody comes in to physical therapy, or when you go to see your doctor, we will ask you a bunch of questions, and we'll ask, really what's going on. When do you have pain? Typical complaints would be, it hurts when I turn my head all the way at the end. Sometimes it hurts the whole time through, but most of the time with arthritis, you'll have pain at the end range of movement. You might have pain in the neck, shoulder, or arm. People will tell me that they really just don't feel like they can turn their head as far as they used to. Doing a shoulder check in the car is really difficult. Sometimes you'll have numbness, tingling, or weakness in the arm, although, yeah, that's typically more with a really significant impingement. Crunching noises is very common, and we don't really know why you have crunching noises. Usually it's, some fluid changes, or if it's really bad, then the bones are rubbing on each other. I had a complaint, somebody today is arthritic complaint too, that's common, where people will say they turn their head and it feels stuck, and then they have to wait a moment, and then it unsticks, and then they can move. That's an arthritis complaint. I actually had that same kind of complaint in my big toe. I know we're not here to talk about toes, but it's an arthritis complaint where it sort of feels like a joint locks up, and then it settles, and then you can move. So that's usually something being impinged in there, and it's usually more of an arthritis. When I hear these complaints and someone is over the age of 55, and it's sort of an arbitrary number, somebody can be a little younger than that, but my first suspicion would be more of an arthritic condition is really the culprit, and that the nerve is being impinged because of some buildup of the bone or a narrowing of the spinal canal. If somebody has those kind of complaints and they're under the age of 55, it could be more of a herniated disc, but it could also be an arthritis condition. But usually, particularly if somebody's younger, in their 20s or 30s, it's usually not arthritis. It's usually possibly a disc issue, okay? And they can usually pinpoint an injury, like I lifted something at the gym, and all of a sudden I had pain in my neck. So that's typically the case. So those typical similar complaints, numbness, tingling, or weakness in one arm, usually on one side, head, neck, or arm pain. They usually can't move their head one direction. One side is worse than the other. We may find that when we assess reflexes, neurological sensations, reflexes, or light touch is impaired. That's usually, we know that there's a nerve involvement, then we have to discern, what is it causing it? Is it actually a stenosis or herniated disc? And more often that, if it's a younger person, it could be a herniated disc. If it's someone who's older, then more than likely it's the nerves being impinged because of some arthritic condition. Also, a certain head position may reproduce the arm symptoms. My brother, all of a sudden, he noticed that his arm would fall asleep, and it would only happen if he turned his head actually away from the arm, if I remember right. I can't remember, but sometimes you turning it away from the side of the symptoms can be the problem, because that's where that's how the impingement will happen. Sometimes it's when you turn your head towards the side, and so that's how we discern where the problem is coming from as well. All right, so now we come into more of a musculoskeletal problem. And typically, everybody who has the stenosis or herniated disc or arthritis will also have a musculoskeletal issue on top of it. But not everybody with a musculoskeletal problem will have a herniated disc or stenosis. But everybody with an arthritic, a stenosis, or herniated disc problem will typically have some skeletal or muscular problem as well. So the first thing we're going to look at is more of a skeletal problem. And this is where the alignment or the vertebrae are sort of a little bit stuck in a position. And this is where someone comes in and says, I slept funny and now I can't turn my head this way. That's usually a simple condition that we call an elevated first rib. So if you remember back here, here's that first rib right here. So is it truly shifted up? No, but we call it that because what's happened is the muscles on top of here have really kind of spasmed and kind of don't allow this rib to move normally with breathing and function. And so it gets kind of stuck there, okay? And that is actually a really easy thing to take care of. Again, my sister-in-law had this. She was like dying. Her neck hurt so bad and she couldn't turn. And I wasn't able to get over to her house. So I got on a video and I taught my brother a manual technique to take care of the situation. And it hurt while doing it, but she could move her head immediately. The pain dissipated over the day. And by the next day, it was gone. So it's a very quick, easy technique to do. So if somebody has this, it's really nice to take care of that right away. Sometimes people get what we call like a little rotation in the segment here. Again, what we're seeing is really like a muscle spasm on one side, kind of holding the bone in place. And so it's not allowing it to move with you when you do functional things. And so there are some techniques that we can do to get that into better alignment and better joint play. So between all of our joints and our vertebrae, our joints, we should have a normal amount of joint play in all directions. So that's what we're trying to achieve when we're doing manual techniques there, is to make sure that the vertebrae can move in all those different directions when you need it, okay? This is very common. I see this with everybody who has a neck problem. They're actually not moving in their upper thoracic spine. So when we turn our head, it moves through every vertebrae in the cervical spine, but you should also move all the way down to actually T3 or T4. And I will find that people don't move there for whatever reason. We sit a lot, things stiffen up. And so we're not getting all the movement elsewhere in our body that we need in order to move. So what happens is you turn your head, the thoracic spine is not moving. And so you overuse your neck muscles to try to turn as far as you want to, because you're not getting the movement you need elsewhere. We see this if you come to my other talks. I talk about how your back pain is actually because your ankle isn't moving the way it needs to, and so you overuse your back. So we always have to look at other areas that could be affecting the primary pain part. I mentioned somebody might have jaw pain or ear pain. We'll look at that. Headaches or migraines or vertigo can all be coming from your neck as well. So we'll take a look at those pieces. And that's usually more of a skeletal issue. A soft tissue issue or muscular is really just that. It doesn't have anything to do with the bones, but it will be affecting the skeleton. The biggest piece I see, particularly in young people who are starting out working, now they're sitting at a computer all day, and their core has gotten weak, so they can't hold their neck up all day long, and they usually have pain at the end of the day. They also might have some poor balance issues. So this is a postural weakness problem that is showing up in neck pain. So we start by working on strengthening up your core so you can hold yourself up and your neck can sit on a strong base or body, okay? Your core is every muscle below your diaphragm. So this, if you can tell, is your abdomen. Here's your diaphragm. Down here's your pelvic floor. So every muscle in the front, side, and back make up your core. I mentioned whiplash, and that is literally a strain of a muscle in the front of your neck. This is an interesting piece. People may have neck pain because they don't breathe optimally. They don't use their diaphragm. They tend to overuse the muscles in their neck. So somebody who has asthma, so when my daughter was little and she got diagnosed with asthma, I knew she was having an attack because she would start breathing from her neck and it would look like this. So she couldn't get the muscles in her diaphragm and her lungs to expand, so she had to overuse the neck muscles. So we work on teaching you how to breathe. And I've got the best tool for that we're going to talk about in just a little bit. Soft tissue, you might have neck or arm pain, upper back pain, or people have pain in the base of the skull. So all those are soft tissue issues. And we talked about the core, how important this is. So no matter what your diagnosis is, we're going to work on strengthening up your body so your neck doesn't have to work so hard. And it all starts with your core. And postural training. So here you can see how here is ideal posture. Nobody has this, but this is what we want to see. Everything's stacked on top of each other. Over time, people get, they may have a more curved back out. They may have more excessive curve in. And you can see how your neck and head sit differently depending on the position of your back. Or here from the back view, if you got curve, then you got, your head side tilt. So you're always trying to accommodate so you can see the world truthfully. That's actually the real problem, right? In order to see the world around us, we need to have our eyes level. But if our back is rounded or side bent, then our head has to be in a position that we need to see. And then you wind up getting pain. So very important to address everything below your neck. And just so you know here, if one little rock is out of place, then something else you can have a problem up above or below. Okay, so how do we know if the physical therapy can help? We want to know if it's reproducible. So when I turn my head, like with my brother, he had pain there, and then when he turned his head back, it went away. Usually we can help with that. If you turn your head at the end range, that's when it hurts. So we know it's reproducible. If you have pain all the time and there's no position that you can get comfortable with, that could be a challenge. Although I do find with neck pain, usually there's something that we can help. Most of the time, let's say you lay down, it goes away. There's something that we can do for that. So what's the biggest mistake people make with neck or arm pain? They ignore it. So, these things, if we can get it sooner than later, we can really help it. Now here I included this, see, I don't know if I can get this video to work. Oh, I guess it's not a video. I thought it was. No. Anyway, this is really a cool picture. I wanted to show how this was in Alaska. And this is the year this is a sign saying 2005, and that's where this glacier was, and it's receded up until here. So, you want to take care of your symptoms sooner than later so you don't start having a problem, a long-term chronic problem, kind of like our glacier situation. Okay, so what are your choices? You can ignore it, and you can have a problem down the line, like the glacier. You could do medications, injections, or surgery. There is a place for this. I often find a combination of medication, injection, with handling it, physical therapy, take care of the problem, depending on what it is. Okay. My older folks with arthritis or stenosis or very significant numbness or tingling usually need some sort of steroid, whether orally or an injection, and then we can really take care of it. My people come to me with true musculoskeletal problem. This isn't going to take care of it. This is where we're going to handle it. People who have serious arm symptoms that don't go away, you're getting weaker, you've lost reflexes, or God forbid, you're having some leg symptoms, then you need surgery. So what do we do in physical therapy to help? We do some hands-on work. This is where we do our traditional and non-traditional hands-on techniques to get the joints being optimal movement, reduce any soft tissue restrictions that may be limiting it. And it could be coming from elsewhere. You may have scars in your abdomen that may be limiting all the fascial tissue that's leading up into your neck that we need to work on. Education, huge, huge play. I'm going to come back to education, actually. Exercises, we're going to give you some strengthening and postural exercises and balance to get everything working together. We may be working on vision, getting your eyes working better with the rest of your body, feet, core, hips, all these pieces play a role in how stable our neck is. A form of exercise we call neuromuscular re-education is really teaching your body how to work together again. Okay, that's very important. And then, of course, education, education, education. This is really my primary role is to teach you how to take care of your body, how to move, how to do everyday things, how to have optimal posture. We're going to talk to you about how to sit, how to stand, how to walk, how to move through transitions. So sitting to standing, laying down to sitting up, sleeping positions, how to lift, posture, specific movements such as, which we just talked about, how to sit to stand. Maybe you have an activity you like to do, golfing. So we're going to talk about, take a look at your golf mechanics, running, walking, anything that might be that you want to do. We talked about kayaking in the beginning. I was kayaking. I had an older woman many years ago who was camping and canoeing up into her late 80s, and we worked, how to canoe and make sure her positioning was really good. So this is very important. How many of you were ever taught how to do any of this? Right? Kids just, you go through stages, you learn how to sit, you crawl, you stand, you walk, run, and you just do it. And then, over time, a little injury here, a little injury there, a fall, puberty, all these things make changes in our bodies, and we adapt the best we can, but they may take a toll later on in life. So it'd be really nice if we could get in and grab those kids early on and teach them how to do all these things optimally. All right. So this is the tool that I talked about that really has been a big change in my practice. This is called an OOV. We don't really know why. It was created by an Australian osteopath and biomedical engineer, and it is designed to work your body three-dimensionally so you do not compensate. So you could lay on your back. I could have you standing. You can see this is an older gentleman. It's between his back to help you with your posture. Balance, really getting your leg working. This is neuromuscular reeducation. Here I have someone stepping over. I do this with my young people, my older folks, no problem. Here's my son doing a more advanced technique, standing on one leg, and I have him pulling down with a band here to really get really challenging his core to work. Okay, so I find this works really amazingly well to really re-educate people how to use their diaphragm for breathing, balance, pelvic floor issues, everything. And then the man created the balance sit. So you can sit on this. Again, this works your pelvic floor, your core, and it really works really well to get differentiating your hip from your core. So everything starts working together better again. All right, the last thing, we really want to know what's going on, because you can't just give out exercises to people. Sometimes people want me to teach them an exercise to do, but without really know what's going on, I can't just give blanket exercises. However, that's not true. There are some that everybody can do. There are some basic core things that you can do. There are some basic postural stuff, really paying attention to your movement. That ebook that I have available will teach you how all sorts of positioning and how to function throughout your day. So if you remember, make sure to put your first and last name and your email in the chat box, and I'll send that to you. Here are some tips that you can do. Sleeping. Sleeping on your stomach is never a good idea for your neck or back. Sleeping on your side with a pillow between your knees, and make sure you have a pillow that fits your head so you're not side bent. And unfortunately, I don't have a good pillow to recommend these days. The one that I do like, I can't find anymore. So if you find one, let me know. Movement. If your neck feels stuck and hurts, don't keep stretching it all day long, okay? In fact, I have people move their neck using their body instead of their head. So if you turn, for example, sitting and just turning your body by looking straight ahead, I am actually getting movement into my neck, but I'm moving my body on my neck instead of my head on my neck. And that may be much more comfortable. Heat or ice is fine. And then, of course, anything to strengthen your core is always a good thing for everyone. Not sit-ups. No more sit-ups. There are core exercises you can do that do not involve doing a sit-up. This is a blog post on my website talking about neck pain. Here are some testimonials, some people who were very happy and can go back to doing what they like to do after their neck pain issue. Okay, so as a thank you for coming today, I'd be happy to get on a phone call with you or a telehealth session to discuss what's going on and provide my recommendations. Just call my office at 847-541-7600, and my admin, Jenny, can set you up for a phone call with me. Okay, here's some information, and I'm going to close out the PowerPoint in a moment, and we can get back onto video. And if you have any questions, I'd be happy to answer them. And let's take a look in maybe in the chat box.
I think you get some names and emails in there. Any questions from anyone? Thank you, Denise. That was amazing. I always learn things about my neck and how to stretch it better than stretching my actual neck.
Yeah. Don't be, forcing it. It's sometimes it makes it worse.
Yeah.
But just moving around down below and side bend like that can be very comfortable. Sometimes even like if I wake up and have a stiff neck, or it's funny, I'm sitting on my stool that rolls, and I'll just kind of turn on the stool
Mm,
until I can get someone to help me.
yeah.
All right. Anybody else? If
Any
put
other
your
questions?
name in there.
No? If you want that, yep.
Okay. Well, thank you all for coming. And I'm not sure
I got it.
we have a talk
Don't worry,
next month.
Denise's next talk is going to be May 16th, Thursday, May 16th, Healing Shoulder Pain Naturally. Yay. Our next talk is going to be on Tuesday, talking about osteoporosis with IBJI at 7 p.m. So if you want to do that, check us out. Otherwise, I'm so excited for Denise's talk next month on the May 16th, shoulder pain, healing shoulder pain naturally. My shoulder's already excited for you. Awesome. Well, thank you everyone today, and you can find this video on our YouTube library. It'll be up later today or tomorrow. And thank you again. Thank you again to Denise. We'll see you next month. Make sure you give the email in the chat box if you want to connect with her and get that book. Awesome. All
All right.
right, everyone. Thank you for
All right.
attending
Thank
today.
you for having me, everyone. Have a nice day. Enjoy the weather.
Yeah,
Bye-bye. Get to
Denise.
the Botanic Garden. The tulips are amazing.
Oh, yeah. Awesome. All right. Bye, everyone.
Bye-bye.
Bye.